Before we begin, I'd like to emphasize that this podcast is an extension of my surgical work and research at Visionary Eye Doctors. And thank you all for tuning in every week or multiple times to kind of hear about our research and how we help patients. And thank you to all of you who have flown in from all over the world to see us here. So I'm very humbled by that. So it is my hope and desire to keep this information free to all of you, especially to my dear patients. And in keeping with this mission, we are very thankful to our first sponsor for this podcast, Wizard Dry Eye Mask. Many of you have heard me talk about the Wizard before. I have loved this product for years. It looks like this. I have one right next to my bed. So does my husband. I used mine last night. And even, if I can't sleep, I'll use it. It's a wonderful product that you just plug in next to your bed or even at your computer. I've been known, if I start to develop a stye, to do the Wizard as I type and then switch, if I have warm, just like a warm compress. So it works wonderful for that. So thank you to the Wizard. If you mention our name, podcast, Visionary Eye Doctors, Dr. Kramer's, they'll give you a 1-year guarantee. If anything happens to the product, just call them up and they'll replace it for you for free. So thank you to the Wizard Research team for sponsoring this podcast. Enjoy. Hi everybody, it's Dr. Sandy Kramers. Thank you for joining us for the Eye Show podcast. One of the most common complaints we get from patients is continuous tearing and foreign body sensation. And we've talked in previous podcasts on how you should never notice your eye. And if you do, there's a problem. It's like having chest pain. And one of the things that can cause that tearing, sometimes burning, reflex tearing, foreign body sensation, blurry vision, is one of the more common things we see, but one of the things we don't treat right away, and it's called Conjunctivochalasis. It's a big word, we abbreviate it CCH, and it's basically wrinkles on the surface of your eyeball. We all have wrinkles on our face as we get older from, years of touching our face and of course gravity and getting older, but the conjunctiva, the eyeball, has the white part of the eye called the sclera, and on the covering of the sclera has a membrane, kind of like saran wrap, that's called conjunctiva, and that can also get older with aging. So today we're going to talk about things you can do to prevent conjunctivochalasis, how we treat conjunctivochalasis, and we'll start off with what really is conjunctivochalasis. So the conjunctiva has many layers. There's an epithelial layer, like the outside layer. There's a tenons layer that kind of connects the epithelial layer, the outer layer, with the sclera. And the tenons capsule, it's called, is a very specific type of tissue that as you get older, as you are in the UV sun, as you rub the eye, that tissue starts to basically get older, degrade, and there's more type of molecules called MMP9 or metalloproteinases that basically cause that capsule that connects the outer layer to the sclera to just get older. Just like your skin has elastin and collagen, the layers of the conjunctiva really are there to actually have a really nice smooth surface, like a well-made bed. It's not supposed to have any wrinkles or bumps. And when there are some bumps, it can disable or disrupt your tear film. So even though you're blinking, and even though the oil might be coming out like golden olive oil on expression of the lids after probing or LipiFlow or IPL or any of the procedures we do, even if the oil is coming out really well, if the bed is not made and there's wrinkles, there's a disruption. There's wrinkles that disrupt your tear film, and it can lead to all the symptoms that we can see with dry eye, namely burning, reflex tearing, foreign body sensation, because there's actually something there that's kind of your feeling. And other things like redness, blurry vision, that's a big one. So we always look for it when we're looking at patients before surgery, let's say, and after surgery, if a patient comes in with dry eye symptoms. So the conjunctivochalasis is something that happens with aging. That is something that we know that cannot be genetically linked to anything, but anytime you rub the eye, anytime you're in the sun without sunglasses, UVB, specifically UV light, is directly toxic to these delicate cells on your conjunctiva. And if you're rubbing the eye, you have constant allergies, and you've been rubbing your eye for years, that constant friction also can cause issues. Anytime you have an eye surgery, whether it's LASIK or chalazion excision or even pterygium excision or cataract surgery, the cytokines, the molecules of inflammation, the MMP9s, can increase and further disrupt this tissue. So it's part of aging as well, not just aging, but there are things you can do to prevent it, such as always wearing sunglasses, avoiding rubbing your eyes, trying to avoid surgery unless you really need it. Those types of things really do help. There's some data to indicate that inflammatory markers in a body can also have a relationship with this, so decreasing your inflammation. As you know, I'm a big fan of decreasing your gluten, sugar, dairy. I would say eliminate it as much as you can. Intermittent fasting, that kind of thing might help. There's no real proof of that, but we want to decrease inflammation because that is what this is due to, is an inflammatory basis. So things like wearing sunglasses, don't be around smokers, don't develop diabetes, all the routine things we'll tell patients. It's absolutely true, because you will get wrinkles on your face with all these things. We know that from dermatology data, and you'll also get wrinkles on your eyeball. And the wrinkles on the eyeball is not necessarily easy to get rid of, but we can. So let's talk a little bit about treatment. So what can we do? Well, most of my patients, once we get the oil to come out normally, usually the conjunctivochalasis is not noticeable. We don't necessarily have to jump in to do surgery. And so what we generally do, we'll see how patients feel. If their symptoms are tolerable, we don't have to jump in to do surgery. But if the conjunctivochalasis, if the wrinkles are very noticeable and you can literally see it flopping over the eyelid, or every time a patient blinks, it's literally almost covering up part of their cornea, we will recommend some procedures. And so there are a few classic ways to remove conjunctivochalasis. Often we'll first try a laser. It's called an argon laser that basically tries to connect the epithelial layer with the sclera by making little tacks of laser marks to tack that conjunctiva back to the sclera. It works in about 25% of patients. It's not 100%, but it does sometimes help with symptoms because it just tries to basically iron out those wrinkles. If that doesn't help, or if the conjunctivochalasis is significant, then we will do excision. And the way we do it usually takes about 10 minutes. It's done in the operating room in our offices. For instance, local anesthesia is enough. You don't need an intravenous anesthesia. The topical anesthesia we use is enough to not feel the discomfort. And we basically just cut out the wrinkles and put some glue down. It's called fibrin glue to kind of iron out those wrinkles. And then we put a little patch of amniotic membrane, which, as you know from previous podcasts, is a wonderful anti-inflammatory that has been shown to heal tissue. So often you don't even see the seam of where we've actually cut and ironed out the wrinkles. There's no scar. So that's the best way to take out those conjunctival wrinkles. What else can we do? Well, there's some early data to say that intense pulse light is not just an anti-inflammatory device on the eyelid, but it may actually decrease the cytokines and MMP9s on the conjunctiva so much that it really prevents further wrinkles. And in some cases, there might be a slight improvement. That's still pending randomized controlled publications, but it's a positive. Similarly, meibomian gland probing, which does seem to decrease inflammatory markers on the conjunctiva and tear film, may also help prevent further wrinkling, even after a procedure, let's say. So those are the best ways to take care of the conjunctivochalasis. The other thing I want to mention to you is basically just don't rub your eye, wear your sunglasses. I don't have data to say blue light makes this worse, but I'm a big fan of blue light filters until we can have really good data. And that's how we take care of it. So the risks of the procedure are very rare. The risk of any of these procedures is that it just comes back or it doesn't help the symptoms. So my tendency is to first try the ways to get the oil to come out better, like olive oil. And when it's coming out like olive oil, not sludgy white toothpaste or even thick sludgy oil when we do an intense pulse light or probing or expression after a procedure, once that's coming out like olive oil, the majority of patients, more than 85% of patients, won't notice the foreign body sensation anymore, even if they have conjunctivochalasis. Should you still remove the conjunctivochalasis? And that is controversial. Some surgeons say, yes, remove any type of wrinkling because it's going to cause more inflammation in the future. And some surgeons would say anytime you touch the eye, there is a risk of getting patients worse. And I've seen those types of patients that have had conjunctivochalasis removal and it didn't help, or they felt even more discomfort. So there's risks and benefits with every procedure, as you know. Talk to your surgeon to see if it's right for you. I'm on the camp of first getting that oil to come out normal because the majority of my patients don't need conjunctivochalasis procedure from a symptom point of view. Is it a risk for further dryness in the future? It can be. But if you're 80, 70, 80, 90, it may not be worth the risk. If you're younger, then it probably is worth the risk. So that's one of those things you talk about with your surgeon. Lastly, I'll mention when you see your doctor, often they can take a picture of the conjunctivochalasis. We have a way of scoring the conjunctivochalasis. You can actually count the number of folds or wrinkles on the conjunctiva. So if you have a question about that, or you see something in the mirror that's kind of moving up and down like a little blob or like a little mucus, it might be this, and just ask your doctor to take a picture for you. I hope you found this helpful. Please pass it on to friends and family, and thank you for subscribing to our channel. Have a great day.